Did you know that in 2023, the United States faced a silent epidemic, a deadly grip that took hold of communities across the nation? Its name, fentanyl. In just 1 year, the number of deaths caused by fentanyl skyrocketed. Fatal overdoses peaked above 112,000 deaths, with young people and people of color among the hardest hit. Drug policy experts and people living with addiction say the magnitude of this calamity now eclipses every previous drug epidemic, from crack cocaine in the 1980s to the prescription opioid crisis of the 2000s. According to former South Carolina Governor Nikki Haley, we've had more Americans die of fentanyl than the Iraq, Afghanistan, and Vietnam wars combined. But what exactly is fentanyl? Fentanyl is a highly potent pain medication, initially prescribed for severe cases or advanced cancer patients. Basically, it is a synthetic opioid. You're probably familiar with opioids like OxyContin, Vicodin, morphine, and methadone. Fentanyl's strength is up to 100 times more powerful, leaving users at risk of accidental overdoses. According to the DEA, 2 milligrams of fentanyl is generally considered a lethal dose for most people. This is equivalent to a few grains of salt. Fentanyl has found its way into the hands of drug dealers and illicit manufacturers. Mexican drug cartels press chemicals into pills, which are counterfeited to resemble pharmaceutical-grade medications for ADHD, depression, and pain. Public health experts say fentanyl is far more powerful than heroin and is responsible for the majority of drug deaths. But the supply of illegal drugs is increasingly complex and perilous. I personally know people who are currently taking opioids, including fentanyl. Most people get addicted to opioids due to an injury of some sort. They need the medication to mask the pain that they're in. After their injury is healed, their body still craves the drugs. They are completely addicted. And when they no longer can get a prescription from a doctor for opioids, they buy it on the street. Drug dealers provide medication to these addicts, whether it be real opioids or not. And then, when they can't afford to buy Vicodin or Oxy, they seek cheaper alternatives like fentanyl, which can possibly kill you. Recently, a former co-worker of mine died from a fentanyl overdose. It was really sad and depressing. He went through a downward spiral from an average middle-class Joe to a drug addict living on the streets. I didn't know that he was taking fentanyl. I did know that he was taking Oxy for a while for his injury from a car accident. My friend was having financial problems since he could no longer work. I often think about what I could have done to help him out. I just didn't know that a pill could kill you like that. Throughout the country, the consequences of fentanyl are devastating. Families torn apart, friends lost, and mourning that seems never-ending. The federal and local governments are trying their best to solve this epidemic, much to no avail. Fentanyl kills someone in this nation every 4.5 minutes. Experts point out that much of the government funding spent onto addiction in the U.S. actually goes to pay for law enforcement and drug interdiction, funding police, prisons, and border security. Not much money or resources are spent on preventive measures to stop people from the start. According to the Cato Institute, a libertarian think tank, total annual spending on the drug war now tops $40 billion a year. That's a lot of money, $40 billion. Some of that money could be spent on drug rehab centers, counseling, and drug prevention education. But the punishment-driven criminal justice system in U.S. only allocates money and resources after the fact, and not at the root source of it. Most drug policy experts agree that the war on drugs system failed to detect or stop the rapid spread of more toxic synthetic street drugs. Efforts to weaken fentanyl production and smuggling by Chinese chemical manufacturers and Mexican drug cartels have failed to curb the supply in American communities. Nevertheless, the fight against fentanyl continues. Law enforcement agencies work tirelessly to intercept shipments and bring down the producers. Communities unite to raise awareness and provide resources for prevention and treatment. Education is key in this battle. By learning about the dangers of fentanyl, we can protect ourselves and our loved ones. It is important to recognize the signs of addiction, seek help, and encourage others to do the same. We need a collective effort to combat this silent epidemic. From stricter regulations to responsible prescription practices, changes must be made to prevent further loss of life. Together, we can bring an end to fentanyl's deadly grip. Join the fight against this silent epidemic and make a difference in your community.